Welcome, everyone, to Monroe Clinic's To The Point. Hello, I'm Kent McConnell with you once again, and today we are visiting with Megan Lane, nurse practitioner working in rheumatology at Monroe Clinic. Megan, welcome.
Thank you. Glad to be here.
Just as we always do on our To The Points, would you mind telling us a little bit about yourself, such as where you grew up, your college, medical school, and how it is you came to practice at Monroe Clinic?
Sure. So I am originally from Brookfield near Milwaukee, and after I graduated from Marquette with my master's, my husband and I, we moved to Texas where I found a job in rheumatology and was there for 7 years. And right around when COVID started, we had decided it was time to come back to Wisconsin and be closer to family. And so I was able to find a job at the Monroe Clinic in a rheumatology department, and so we came over here and are really enjoying it.
Megan, you're a nurse practitioner in rheumatology at Monroe Clinic. Would you mind sharing with us, first, what is a nurse practitioner, and secondly, what rheumatology is?
Sure. So a nurse practitioner is a nurse that goes on to obtain higher education. The thing I like about being a nurse practitioner is it's very patient-oriented, holistic care because we have the nursing model behind us. And then rheumatology is a field that treats different types of arthritis. It treats autoimmune disease, and then often chronic pain conditions and a little bit of everything else sometimes too.
Today our subject matter is fibromyalgia. How about giving us a bit of a definition of fibromyalgia?
So fibromyalgia is a condition, a chronic condition of widespread body pain. And it's not necessarily every day, but the symptoms can include just generally feeling achy all over, chronic fatigue, feeling very unrested when you wake up, and it's caused by an overactive nerve signal in the brain, sending nerve signals to the body that you're in pain all over. And there's a lot of associated conditions, including irritable bowel syndrome, migraines, restless leg syndrome, fatigue, fogginess, memory problems. And it can kind of go on and on as far as other associated symptoms.
Megan, when you see some of your patients, what are some of the questions you might ask to find out whether or not they may have fibromyalgia?
The symptoms can vary, but a lot of times I'll ask things like, do you ever feel like you wake up and you've been hit by a bus? And believe it or not, that's a very common symptom that I even had one person say, I've never heard it put so correctly. Another example is, do you ever feel like you ache all over, like you have the flu, but you don't have the flu? Some people will describe that they're sensitive to the touch, so they may have a cat or a small dog or a child that walks all over them and it hurts like it shouldn't hurt, or they have somebody hug them and it doesn't feel good. So you feel kind of bruised all over. You can even look around your body and see if you have a bruise because it feels that way, but you don't. So those are some of the questions I'll ask, along with, do you feel good when you wake up? Do you feel like you've rested really well? Or do you still feel tired? Does it feel like your skin has sunburn on it or that your clothes are uncomfortable? Those are some of the other questions I've asked.
Now, when you are speaking with a patient, could just one of these symptoms lead you to believe they have fibromyalgia, or is it usually a combination of?
That's a great question. So the symptoms have to first be excluded from any other sort of chronic pain or rheumatology condition. And if everything else is excluded and some of the symptoms are matched up, yes, that can be a diagnosis of fibromyalgia. And a lot of times I tell my patients that fibromyalgia likes to piggyback onto other conditions. So often they will have something else going on, whether it's lupus or rheumatoid arthritis or degenerative back disease or even depression, anxiety, or post-traumatic stress. Fibromyalgia likes to tag along secondary to those conditions, unfortunately.
I might be a little bit incorrect here, but some of these symptoms would lead me to believe they're similar to having COVID.
Oh, that's interesting. The symptoms are usually present for much longer than that. So the symptoms, by the time people get to me, they've been going on for quite a while, years even, because the symptoms don't generally just appear out of the blue. They gradually worsen and become more interfering to someone's life.
We're visiting today with Megan Lane. She's a nurse practitioner in rheumatology at Monroe Clinic. And Megan, when you're visiting with your patients, what treatment options do you recommend for people with fibromyalgia?
There are several different things we can do. The most effective treatment is activity, physical activity and exercise. So finding something that feels good to be doing, whether it's walking or yoga or Tai Chi or swimming. Swimming is a very important type of exercise. Just something that can get the body moving is the most effective treatment. There are medications we can try. Some people do well with different complementary treatments like massage, although some people can't stand it because they're too tender. Some people do chiropractic or acupuncture. There's some supplements. Heat can help, weighted blankets, lots of things we can try and discuss.
Now, I understand that you have a special interest in treating patients with fibromyalgia. How is it that you came to develop this interest?
Well, over the last 8 years treating patients in rheumatology, I have seen quite a few people with fibromyalgia, and they often feel that they're not listened to or that they've been told that their symptoms are all in their head, and it's very distressing. And so I decided I wanted to work with these people and try to help them feel better however I can. And it's truly a group effort. The patient and I have to work together to find things that help and work together to figure out how to make their lives better.
Now, a thought did come to mind here. Can fibromyalgia lead to depression, or can it be the other way around? Can depression lead to fibromyalgia?
Absolutely, and a lot of the medications that we can use are also indicated for depression. And so I like to think of it as more interrelated, and oftentimes, yes, having chronic pain every day will cause depression. Not sleeping well every night will cause depression. And on the same note, having chronic depression and not sleeping well will often cause chronic pain. And so it's important to address all of these symptoms and related conditions while treating a patient. And they'll say that if they're having a really bad pain day, you'll be more depressed. Or if you're having a really bad time with depression, you tend to ache all over. So,
Megan, if folks want to get a hold of you, if they feel they have some of these symptoms, do they have to be referred, or can they contact the rheumatology department directly?
They can call the department at 608-324-2811.
All right. Thank you, Megan, for being with us today.
Thanks a lot.
We've been visiting today with Megan Lane. She's a nurse practitioner in rheumatology at Monroe Clinic. For Monroe Clinic, I'm Kent McConnell, and this has been Monroe Clinic's To the Point.